Hello, my dear students. I think the AIMS exam was very easy for you regarding pharmacology part of you. We are going to discuss some recollected question from AIMS paper. The first question we are going to discuss is a lady on a drug treatment for migraine with a history of coronary artery disease came with chest pain and heaviness. Which drug responsible for this event? The options given are serotonin agonist, serotonin antagonist, diltiazem, and nitric acid donor. I think this is a straight question. The answer for the question is option number A, serotonin agonist. Why this is the answer? Let me explain. Here the patient is having history of coronary artery heart disease. Following treatment for migraine and developed chest pain and chest heaviness. So the given drug may aggravating the coronary artery disease that causes chest pain and heaviness. That means most probably it may be a vasoconstrictor. With this knowledge, now look here. For a case of acute migraine headache, here the problem is a vasodilatation. So for treating acute migraine, we need to give a vasoconstrictor. Usually we try first, for any headache we try with the paracetamol. If there is a vomiting, we can add antiemetic also. But actually in a case of confirmed case of acute migraine, we have to go for vasoconstrictor. The most important group of vasoconstrictor what we having is, one is called ergot alkaloid, one more thing called 5-HT1BD agonist. Look here, 5-HT1BD agonist. They call serotonin agonist. Serotonin agonist useful for acute migraine and they are causing vasoconstriction. For example, ergotamine, we have ergot alkaloid ergotamine. 5-HT1BD agonist means lot of drugs are there. For example, triptans, sumatriptan, risatriptan, almotriptan, fravatriptan, zolmitriptan. So those drugs names ending with the suffix called triptans, triptan. They are called 5-HT1BD agonist, serotonin agonist, useful for acute migraine and they are causing vasoconstriction. So I think in my regular class as well as in TND paper we discussed already vasoconstrictor. When you are using, be careful in a patient with coronary artery disease, that is ischemic heart disease patient and in hypertensive patient, because they are going to aggravate the chest pain, may cause chest heaviness. So it's a straightforward question from this paper. If a migraine patient that too having coronary artery heart disease following a drug therapy developed severe chest pain, main thing of serotonin agonist. So straight question. Why not others are answered? Why not the other options are not answered? We discuss. Before going to other option, let me discuss an extra point. Hi, look at it. Ergot or group of drug like ergotamine on chronic use they cause vasoconstriction. Thereby the peripheral circulation get affected. Look at the picture. For your near coming NEET examination, it may be useful. Chronic ergot therapy may cause gangrene of the foot. It is called ergotism. It is also called Saint Anthony fire. So if they are given picture like this, following a drug therapy patient developed a problem like this, means think of ergotism or also called Saint Anthony fire. Now coming to other extra points, sumatriptan not only having analgesic action, it suppresses nausea in case of migraine. So the one and only triptan, in addition to having controlling headache, also having anti-emetic property sumatriptan. And the beauty of sumatriptan, it can be used orally or subcutaneous injection, even intranasal administration. Different formulations are we having. And coming to risatriptan, it is the fastest acting triptan and having highest efficacy. Regarding almotriptan, it has highest oral bioavailability. Regarding triptan, it having longer half-life. Zolmitriptan, nothing special. So, first option, serotonin agonist may cause vasoconstriction. They are all contraindicated in a patient with hypertension and with coronary artery disease. Here I want to add some extra points also. For prophylactic therapy, we have a lot of drugs. See, migraine is the one condition where the headache is going to come recurrently. So to prevent the recurrence of headache, we have to put the patient on some prophylactic drugs. The most commonly used prophylactic drugs are beta blocker. I put MC. MC means most common. That is beta blocker like propranolol. And then we can also use CCB like flunarizine, or we can use verapamil. Verapamil or flunarizine useful for prophylaxis. Here important point. Flunarizine is a very important MCQ question. Please note. Flunarizine actually a T type of calcium channel blocker and is also having some other activity like blocking sodium channel and also having antioxidant activity. So flunarizine means 3 point. It's a T type of calcium channel blocker, additionally having sodium channel blocking property and antioxidant activity, useful for prophylaxis of migraine. And regarding, there are some anticonvulsants useful for prophylaxis, for example, valproate, gabapentin and topiramate. This is also important expect need question. Which are all the anti-epileptic also useful for prophylaxis of migraine? Think of valproate, gabapentin and topiramate. And tricyclic antidepressant like amitriptyline can be useful for prophylaxis of migraine. And then clonidine, alpha-2 agonist, and botulinum toxin, botulinum toxin A, useful for migraine. And finally, there are some serotonin antagonists like pizotifan, cyproheptadine and methotrexate. They are also useful for prophylaxis. Here what you should concentrate is, look here, the cyproheptadine, very important MC question. Cyproheptadine actually belonging to antihistamine group, first generation antihistamine, so having H1 blocking property. We all know most of the first generation antihistamine also having anticholinergic property, that is anti-muscarinic property. Of course, this drug also having anti-serotonergic activity. So cyproheptadine 3 action: antihistaminergic, anticholinergic and anti-serotonergic. This drug not only useful for prophylaxis of migraine, it is also used as an appetizer and also useful to control symptoms of serotonin syndrome and carcinoid syndrome, and is also useful for the treatment of delayed orgasm. There are some people having sexual dysfunction of delay in orgasm. They are not able to ejaculate. For them to promote ejaculation, we can use cyproheptadine. Finally, one more drug, methotrexate. Methotrexate actually a 5-HT2 blocker. Today this drug is not in use because the drug causes so many problems like retroorbital fibrosis and retroperitoneal fibrosis. So this drug is not in use. So leave it. Now concentrate in my discussion. Look here. Calcium channel blocker having vasodilatory property. They don't causes chest pain or chest heaviness. And then serotonin antagonists. They don't cause problem of headache. Problem of chest pain. And in your question option 4, nitric oxide donor, they are not useful for migraine, and nitric oxide donor going to never cause chest pain or chest heaviness. So clearly I am telling the group of drug causing aggravation of coronary artery disease in a patient who is on anti-migraine drug mean think of serotonin agonist like 5-HT1B agonist like triptan group of drug. That's clear cut. After understanding the question and all the options, now I give some new information. Okay. For the treatment of migraine headache, we have some newer approach. For example, look here. There's one thing called CGRP. CGRP means calcitonin gene related peptide. Actually, this peptide having vasodilatory property. Vasodilatation is the cause for migraine headache. So, for the control of migraine headache, we have to block the CGRP. So, we have some CGRP antagonists. For example, note this point. Newer drugs. What are the important newer drugs available for treatment of migraine headache? That's also important question for you. Remember, CGRP antagonists are we having all CG bands given intravenously. There are some more drugs given orally. For example, telcagiban, UBRO, obrogiban, one more newer drug, RIME, Rimegiband. So remember, all the drug name ending with the Gban, G-P-A-N-T, Giband, all C-Gban, telcagiban, obrogiban and Rimegiband. All are CGRP antagonists. In this, one more very important information you should know, that means there are some monoclonal antibody. Remember doctor, there are some monoclonal antibody acting against CGRP, targeting against CGRP, useful for migraine. Examples of erinumab, fremanezumab, galganezumab, and one more latest is eftinezumab. All these are monoclonal antibody useful for migraine acting against CGRP. This point important. And finally, one more latest point. For the treatment of acute attack of migraine, we have a new drug called lasmiditan. Lasmiditan is a 5-HT1F agonist. 5-HT1F agonist, serotonin agonist. Lasmiditan is a new drug. So, doctor, here in this video, we discussed what are all the important drugs useful for managing acute attack of migraine and drugs useful for prophylaxis of migraine and also newer drugs useful for migraine headache. In that, your exam question, what is asked in AIMS exam was, which is the group of drug going to aggravate coronary artery disease and precipitate chest pain and chest heaviness? Mean think of serotonin agonist like 5-HT1BD agonist because they are causing vasoconstriction, so unsafe in coronary artery dissipation and hypertensive patient. With this, I am finishing this video. All the best. Thank you.